Thriving in an ecosystem for health. What if I took that and changed it a little bit? I want to talk a little bit about designing an ecosystem for healthy living. That through collaboration with others, we're able to make change possible. I want to start with a question. What's your favorite healthy place? I'll bet that there are as many definitions for healthy place as there are people in this room. Some of you might think of healthy places as thriving, interconnected urban settings like New York or Copenhagen. Others might think of rural retreats like the Boundary Waters. But ultimately, the physical conditions in those environments are allowing for health outcomes to be derived. Not just physical health outcomes, but mental health outcomes as a result of social interactions in the places for people. It's places, it's zip codes that we're able to design every day to help think differently about ways of transitioning health care into the care for one's health. The commercial real estate industry is a $1.1 trillion industry globally. Our group of 140 architects, planners, landscape architects, and interior designers think every day about opportunities to put that to work in different ways, to think creatively about creating the latent conditions that will facilitate improved health outcomes. I know the traditional care pyramid very well, having grown up here in Rochester, Minnesota. In fact, this space is one of the first things I ever drew as an architect. Increasingly, however, we're interested in ways of transitioning from this care model in a reactive mode to ways of thinking about commercial real estate and how we can broaden the base of this pyramid to establish a more sound foundation. To think about ways at a lower cost we're able to use the physical environment to improve those health outcomes and move dollars away from reactive care into conditions that allow for the improved health and well-being of the people that you spend your time with. It's not just us who are looking to these ideas. It's groups like the Federal Reserve Board who have recognized that the increased expenditure of GDP represents a material risk to the economy. And as a result of that, we're looking at other ways of collaborating with groups who are like-minded. In our case, we reached out to the Center for Design and Health at the University of Virginia. The University of Virginia thought creatively about breaking down historic silos and thinking about ways of bringing together the business school, the medical school, and the architecture school. We were ultimately able to commission a paper that identified, through the peer review of some 600 articles, 9 common principles that help to provide health outcomes. Pre-development ideas like smart location, choosing the sites where we're going to build. Other things that we as designers can be doing, the integration of nature, the mixing of uses, of incomes, of generations, and other things that ultimately can instill pride of place through long-term programming. In recognition of the transformed community and the scientific approach to things, I have to acknowledge it wasn't a scientific research effort. There's a reality that self-selection has driven many of the results that you get in these types of papers. People who move to Denver, who move to Austin, Texas, who move to Phoenix, have certain aspirations. But other people have come before and recognized the opportunity to bring together commercial real estate and health and well-being. Even though this is a General Mills state, John Kellogg, who might have provided the cereal I had for breakfast this morning, recognized this opportunity in the 19th century. For us, in the 21st century, we're looking to long-term clients like Mead Westvaco, Westrock, who's moving projects forward like Nexton. As we sat with them and we began to think about ways of creating the latent conditions in the built environment across 5,000 acres, the first question to us was, how does it affect my bottom line? Ultimately, we were able to devise solutions through collaboration with a multitude of partners, where we were able to deliver the nation's first gigabyte community, where information technology was able to accelerate change, where we were able to create a reverse school day where students are doing their homework in the classroom with teachers, to then watch lectures over Wi-Fi in the parks. Other places that we've been working include urban infill neighborhoods like Bay Meadows in the San Francisco area. Places where thriving, interconnected street networks allow for active transportation. People walking to work, people walking to the shops, people biking. Ultimately returning the public domain from cars to people. The site is located with easy access to the city of San Francisco and down to the Silicon Valley. The improved air quality, as we start to think about the transit-oriented development, is immediately apparent in the improved health outcomes of people who live there. But it's not just the physical solutions, it's the long-term programming. It's thinking about ways that we can bring together groups of the community, but also individuals interacting over the rooftop garden, of learning about and cultivating crops, of interacting with and understanding the benefits of healthy fruits and vegetables. Ultimately, it resulted in a conversation that had accelerated sales at a premium above the market. It's that transition as we look at the evolution of sustainability from environmental awareness to the building technology of LEED and the green building movement, to increasingly thinking about the people that occupy the places that we design every day, and then long-term to establish and understand partnerships where we're able to have conversations about health and well-being and its return on investment. With that, we'll be able to collaborate to design ecosystems for healthy living and to make change possible. Thank you.